Hi, my name is Skylar Nichols, and I will be covering the From Novice to Expert theory by Patricia Benner. Patricia was born in 1942 in Virginia and was a nurse in the late 1960s after completing her college career. Her career started with her college education. Benner received a Bachelor of Arts in Nursing in 1964 from Pasadena College. From there, she got her Master's in Medical Surgical Nursing in 1970 from the University of California at San Francisco. In between these two college educations, she was also serving as a research associate in a lab at the University of California in San Francisco. The last of her college education was completed in 1982 at University of California at Berkeley, where she received her PhD. After finishing her college and starting out her career, she worked in the head nurse position of the coronary care unit at the Kansas City Hospital, and she also served as an intensive care nurse at Stanford University Hospital and Medical Center. She also worked in the lab as a research assistant at the University of California at Berkeley. As of right now, she currently works in research and teaches at the University of California at San Francisco School of Nursing. While teaching at the University of California at San Francisco School of Nursing, she has also been very successful in other aspects. Benner has written and published 9 different books about her theory and nursing in general. Her most popular book is From Novice to Expert: Nursing Pathways for Patient Safety. She has also published multiple articles about nursing, having to do with her theory and just the career of nursing in general. She also received the 15th Helen Naum Research Lecture Award in 1995 from the University of California at San Francisco School of Nursing. The key points of From Novice to Expert theory. This theory explains that nurses can gain more knowledge and skills about patients and patient care through the experiences that they've had from past patients and the education that they've received. Benner said that nurses could gain knowledge and skills without actually learning a theory and just learning based off of their past. This theory has 5 different levels of nurses. The first level is novice, a nurse that is a beginner with no experience. The second level is advanced, a nurse that has gained some knowledge from personal experience. The third level is competent, a nurse that has 2 to 3 years of experience. The fourth level is proficient, a nurse that understands all situations fully and can make decisions. And the fifth level is an expert, a nurse that has a deep background and perfect understanding of all things nursing. This is a visual description of the From Novice to Expert theory that shows how a nurse can grow from a novice to an expert. Benner says that the transition from a novice to expert usually lasts around 5 years, although sometimes nurses can get stuck in the competent or the proficient phase. The novice has no professional experience and is just now starting out a career as a nurse. A beginner nurse can note recurrent, meaningful situational components, but not prioritize between them. A competent nurse begins to understand actions in terms of long-range goals and can better learn to make decisions based off their past. A proficient nurse perceives situations as wholes rather than in terms of aspects, and also looks at decision-making based on a long-term view. An expert nurse has an intuitive grasp of a situation and zeroes in on the accurate region of the problem. Benefits of this theory. This theory gives nurses a chance to grow their knowledge through their own experiences and relationships with their patients. By learning from their past experiences, nurses are able to grow stronger and learn how to handle tough situations more easily. This can help them make better decisions based off of decisions they've made in their past that either went right or wrong. With this theory, it could help nurses make better decisions with future patients that they might not have known how to make in the past, but can make now. Nurses are considered experts by the way they care for their patients, not by their paycheck or their status. The 2 limitations of this theory is that depending on where the nurse works and what type of nurse they are, it could sometimes be hard to gain experience. Such as if a nurse is in a field where the same thing happens each day, they don't have the chance to learn from their past to improve their future. And nurses might not be able to completely grasp the knowledge that they learned from their past experiences, which means that they cannot apply it to future patients. Applying the theory to patient care. This theory can be applied to patient care and can benefit the nurse's future patients. By their past experiences, nurses can learn the best way to care for their patients to make them satisfied, based off seeing what worked on their past patients, or didn't work. If a nurse has made a mistake in the past with a patient, the nurse can come up with ways to prevent that mistake and learn from their experiences. The theory related to my view of nursing. From my point of view, this theory perfectly sums up my view of nursing. Reading about this theory has helped me discover that good nursing does not only come from an education and a good job, but also the way that a nurse treats their patients. The from novice to expert is an important theory to know about because it happens to each and every nurse. Every nurse should learn from their past experiences to make sure that they are treating their patients with the best possible care and respect and continuously growing in their career. These are my references. Thank you.